Good evening. I want to thank everybody who's watching us, and I want to introduce myself. I'm Dr. Rimal Hassan. I'm a specialist in gastroenterology, hepatology, and proctology. I'm working in Medcare, hospital, women, and children. Today, I'm going to talk about four things. First of all, I will explain what is proctology mean, what is anorectal diseases mean, hemorrhoids, and painless hemorrhoids treatment. Let's start from the beginning. What is proctology? Proctology is a kind of science that deals with the diseases or the problems related to the anus and the rectum. This is proctology, and all these symptoms related to this area, like bleeding, like pain, anal pain, like constipation, like incontinence, all these problems is studied by proctology or proctologists. Now, anorectal that means disease related to the anus and rectum. Rectum is the lowest part of the colon. So everything or the disease related to this area, it calls anorectal diseases. We can say many range of these diseases like anal fissure, fistula, prolapse, hemorrhoids, thrombosis, malignancy, and sepsis, etc. All this disease is treating by anorectal or anorectal specialties. Now I will make a focus on one of these diseases. It's hemorrhoids. What is hemorrhoids? Usually it's simply enlarged vessels. Hemorrhoids, it's enlarged vessels, swollen vessels. When it's in the leg, we call it varices. But when it's in the rectum or the lower rectum, we called it of course, hemorrhoids is the most embarrassing talk about in all over the world. Even though most of the people, men or women, can suffer from this at least once in their life, but still it's embarrassing. For that, in the past, all the people can leave themselves in pain, in bleeding, and avoid to go to the doctor until they reach to the advanced cases to go directly for operation. I will go back to what is hemorrhoids exactly. Hemorrhoids, it's a fibrovessels cushions. That means it's a fibro artery veins located in posterior. It's anatomically located in this area. Now, for some reason, these cushions, it's just to transfer the blood from the pelvis to the anorectum and from the anorectum to the pelvis, so in pathways. For some reason, these vessels can be swollen and become enlarged and inflamed. The reason is most probably the high pressure in the abdomen, which has happened when the woman in pregnancy, when there's a severe constipation, when there's hypertension or portal hypertension. So the vessel will be inflamed and become swollen and enlarged in size. Now, when we talk about the hemorrhoids, we should speak about something else it do it. It can helps by the forming the stool. How it's? We can say the cushions get around 15% to 20% to control the pressure of the anal canal. That means it can help by forming and continence the stool. We will talk about this later. That's why I mentioned now about this. Now, how can we define the hemorrhoids? We say it is vessels, but we can divide them to two parts, internal hemorrhoids and external hemorrhoids. This should be divided, depends on the dentate line. Dentate line is in the anus, It's a line, can the physician prescribe it? It's just a change or moving from one kind of epithelium to the another. Why we should divide, or why we should recognize the internal from the external? Because external hemorrhoids, that means it's below and distal from the dental line. It's outside of the dental line. It's outside from the anus. And it's more important, it's painful because there is many sensory nerves. But the internal hemorrhoids, it's inside the rectum. That means it's above the dental line. And it's painless because there is no sensory nerves inside. That means all the hemorrhoids inside the body is not painful. Only if it's go outside, it will be painful. Why we are speaking about that? Because we want to make a graded these internal hemorrhoids. Graded them by the degrees can give us the good opportunity to choose the suitable way to treat these hemorrhoids. For example, and degrading these hemorrhoids depends to the prolapse. For example, the first degree, that means the hemorrhoids or the vessels become bigger, enlarged, swollen, and just prolapse to the center of the anal canal. This is first degree. Now, second degree, that means the prolapse, it will be the prolapse will be to the anus, and it spontaneously go back to its place while defecation. Now, the third degree, the hemorrhoids will prolapse while defecation and go outside the anus, and it needs manually reduction to go its place. This is third degree. Now we will reach to the fourth degree, which is the last one. Fourth degree is when the hemorrhoids with the defecation prolapse outside the anus, and it can stuck outside the anus. We are taking care of the degree exactly to put the suitable treatment for that. For example, the fourth degree, that means the hemorrhoids outside, this is surgical case. The patient should go directly to the operation to recession the hemorrhoids. Sorry. Third degree, we have two ways. Maybe we can send for recession by operation, or we can remove the hemorrhoids by the band ligation. First degree and second degree, this is what I want to focus on. This is 2 degrees, the prolapse is just go outside to the anus and go inside. Why I want to focus on this? Because in my practice, I notice many people, they don't suffer from pain, but they suffer from something else. For example, they came to the clinic, they said, "Doctor, we have difficulty in defecation. Doctor, we are straining too much in the toilet. We feel like a block in our anus, or we feel fullness after defecation." All these symptoms or complaint from the patient, from the first sight, you think it's something normal, but it's not normal. It's something related to the hemorrhoids. We can explain this is first degree or second degree hemorrhoids. And as I mentioned, it's painless. So the patient has no pain, but suddenly have these symptoms and suddenly have painless bleeding. For that, he came to the physician and asked about this problem. And that's why I'm just focusing on this, because in this case, when the patient comes, he has good opportunity to get rid of the hemorrhoids. This is in the first degree, let's say, or second degree. We can control by changing his life, changing his habit, give him more fiber in his food, increase the intake of the water. We can give him some topical creams. And the most important thing that we can go for easy way to get rid of these hemorrhoids, which is called infrared coagulation. Infrared coagulation, it's a kind of heat energy, same the heat that we make our food is ready to eat, the fast food. It's heat energy. It's just we can focus in a probe and put it on the base of the hemorrhoids. When we put this kind of energy, that means we are burning the base of the hemorrhoids. Burning the base of hemorrhoids, we are doing two things. First of all, we cut the supplier of blood to the hemorrhoids, which is reduce the bleeding, and it's coagulate the vessels. And the second is, under this burning, there's an ulcer. This ulcer, after 1 week or 2 weeks maximum, it causes fibrosis. And this fibrosis, that means it makes stocking of the epithelium to the muscle. That means there is shrinking of the hemorrhoids. This is what we need. So we get rid of the hemorrhoids by simple way. We stop bleeding, stop the high pressure in the canal that it caused the difficulty in defecation. So when the patient come and he said, I have constipation, if we treat these hemorrhoids by this way, he can defecate easy way. So that's why I wanted to mention to this procedure. It's very easy. It's painless. It's done in the office within 5 minutes, and it's local anesthesia, and the patient can get the result within 1 week. That's why I wanted to focus on this machine and on these hemorrhoids. Now I think I finished my topic, and the conclusion is, when the patient feels any discomfort or difficulty in defecation, he should go and consult the doctor, not tell himself this is normal. Now I think we will move and speak with Kimia to ask her if there is any question from the audience or from the other watching
yes.
us.
First of all, good afternoon, doctor. Thank you so much for joining us for this very important topic. Yes, doctor. Thank you. So going ahead, this is a very sensitive topic, and like you said in your session, there are people tend not to speak about this very openly.
Yes, it's embarrassing. Yes.
However, it is an important topic, and we see this happening very often nowadays. First, one of the questions that is there: are hemorrhoids naturally curable?
Okay, first of all, I will tell you, most of the people in their life between 16 years till 60 years old, they will suffer at least once in their life from hemorrhoids.
Oh, okay.
But we can avoid to have hemorrhoids by going by good habit. What that means? That means we should not have constipation.
Okay.
We should not go for the toilet and stay in the toilet straining for a long time. Okay. We should avoid staying for a long time or sitting for a long time.
Okay.
And we should add more fiber to the food to laxative the stool.
Okay.
And of course, it's important to have too much water. At least the person should drink 3 liters within 24 hours.
Within 24 hours, 3 liters.
It's very important not to have this severe constipation.
Okay.
Especially, I want to mention this, especially for the women while they are pregnant.
Okay.
It's very important because at least they have high pressure in their abdomen because of the pregnancy. If they avoid it by constipation, they will face big problem with hemorrhoids.
Okay. So can we say constipation is one of the leading causes of hemorrhoids?
Yes, of course.
It is.
Everything can increase the pressure in the abdomen is the cause of hemorrhoids. So constipation, pregnancy, mass, sometimes if there's any malignancy in the uterine or in the pelvis, it can make
Okay.
high pressure in the pelvis. That means it causes hemorrhoids.
Hemorrhoids. Okay. So you also said pregnancy is one of the leading causes for hemorrhoids. So does that mean women are more prone to it than men? Is it
Yes, most probably because of the pregnancy.
because of pregnant, but
Yes.
unmarried women, and if you look at
But
that,
both of them has hemorrhoids.
both of them are.
Yes, both of them has hemorrhoids. Not the equal percentage, of course, the woman more, but both of them has this problem.
Okay. And are there any oral procedures or oral treatments rather that they can come, patient suffering from hemorrhoids can come and just take an oral treatment before actually going in for a procedure or a surgery? Because that's a fear they generally would be having.
Usually we go for conservative treatment. What that
Okay.
mean? That mean we will give him, or the patient, we will give him topical cream, we can give him some suppository, and sometimes we can give him tablets or oral medicine for, as I mentioned, for laxative and for to get rid of the pressure of the vessels.
Okay.
Sometimes it helps. It's not too much, but it can help sometimes.
But when they have hemorrhoids, it's okay to give suppository. Are they open to it, or does that?
No, they can get suppository because it can, especially with menthol and lidocaine, because it decreases the pain and it decreases the congestion of the blood.
Okay. Also, doctor, do hemorrhoids lead to cancer? Are they cancerous?
Itself, the hemorrhoids, it's not lead to cancer,
Okay.
but sometimes maybe it's a kind of hiding the cancer. So somebody has hemorrhoids and he has bleeding, so he will not take care of this bleeding and go for more investigation. He thought this is just only hemorrhoids. Instead of that, he is hiding mass or malignancy in his colon. That's why always we mention, we mention every rectal bleeding.
Okay.
Although we know it's hemorrhoids, it's important to make investigation for the colon first.
Okay.
Because we don't want to hide the malignancy or any mass in the colon while we are just treating as a hemorrhoids.
Okay. Just as a side question, I think the mask has made your voice a little low. If you can just speak a little louder, or we can just
I will try.
Yes, we just want to make sure everybody hears you loud and clear, and everybody benefits from this.
I'm going to live with this mask for a long time.
Yes. Well, let's see. Hopefully, everything will be fine soon. Also, are there any identifications that one can personally notice and think about it? Try to be their own judges or their own doctors before they actually want to come to the doctor.
The patient himself, he doesn't know and he can't decide.
Okay.
The decider is the physician who examined the patient. But there is one let's say, sign. If the patient has lump outside his anus and they are big and they are very painful, and that's mean this is dangerous case.
Okay.
This case should be go directly to the doctor, because maybe it's a thrombosis, maybe it's ischemic, maybe it's degree 4th, and this is need to surgery. Okay. But who decide the treatment is the physician.
Okay, they decide on it. Can hemorrhoids lead to any kind of fatality, or can it be fatal?
No, actually no. As I mentioned, it can cause bleeding.
Okay.
But this bleeding, it's not lead to severe anemia.
Okay.
Unless it has complicated with something else. For example, ischemic or something severe infection. It has another complication, but it's hemorrhoids itself, it doesn't.
It doesn't. It's not the same. Also, can you speak a little bit more about the diet that they should follow in order to avoid hemorrhoid or cure it if they have it?
Yes, it's very important. The people should add more fiber. Why we, for example, this is in our countries, in the Middle East or these countries, our food depends on the fruit and vegetable, which is very high quantity of fiber, which is very good.
Okay.
The problem which the Western countries face, because they go for fast food and decrease the fiber in their food.
Okay.
Now, we got this habit from them, so we decrease the fiber, so we got this problem. As I mentioned, 3 liters within 24 hours, that would be fine.
That would be fine. Also, doctor, you mentioned in your talk about the latest technology that we have, which takes only 5 minutes and under local anesthesia. Can you expand a little bit about how it's different than the previous ones that we had?
Yes, this is not new technology, but it's very effective.
Okay.
When we decide who is the candidate for this procedure, it will be very effective. This is infrared coagulation. It's a kind of light.
Okay.
It gives heating. This heating, we can focus on the base of the hemorrhoids.
Okay.
As I mentioned by my topic, it's burn the base of the hemorrhoids.
Okay.
It causes fibrosis, so it's block the supplying of the blood from the artery or veins to the anorectum.
Okay.
This blocking the supplier, it's make the hemorrhoids shrink. So
Okay.
that's mean we get rid of the hemorrhoids, but it should be in the first and second degree, not more than this.
Not more than that. Okay, that was my question. So there is a limit to how much that
Yes,
technology
of course.
can.
Every stage, as I mentioned, every stage or every degree, the doctor decide which kind can more effective.
But do you come across many stage 2? You
No,
tend to come.
The problem, as I mentioned, Kimia, the problem is the people, they don't believe they have hemorrhoids until they have severe pain or severe lump in the anus, or they feel rectal bleeding, severe rectal bleeding.
Okay.
In the first stage, they don't notice. That's what I'm just focusing. I want the patient to be aware when they have any change in their habit or they feel there is, they usually say it's a constipation, but it's not constipation.
Okay.
They said it's constipation because they spend too much time in the toilet, but it's not. It's a kind of hemorrhoids. It's blocking the anal canal and it causes difficulty in defecation.
Okay.
In this case, we can treat so early and we can get rid of the hemorrhoids.
Okay. Okay, so that's one thing. The other thing is, are hemorrhoids genetic? Like just because it has family history?
Usually it's genetic. Usually it's come in the same families, and of course the heredity and the families and the lifestyle. It's all these factors to make hemorrhoids.
Okay, so, and at what stage of the hemorrhoid thing, at what stage do they start bleeding? Because there are certain hemorrhoids that bleed and then there are certain that do not bleed. But
all the hemorrhoids can bleed. Okay. The first degree can bleed, but it's painless. So sometimes when the patient come and he notice, but this is very important to speak about this bleeding. The bleeding of the hemorrhoids, usually it's come after the stool. It's not coming with combination with the stool.
Oh.
It's very important to know that. It's come after the stool, above the stool, above the pan. That's why it means this is a kind of hemorrhoids or anorectal bleeding. Okay. But if it's in the occult blood or it's combined with the stool, this is not from the hemorrhoids. This is something from the colon. You should take care and make more investigation because there's a problem in the colon. Okay. So all the hemorrhoids can bleed, but depends to the degree and depends to the let's say circumstances around this. For example, if the patient has hemorrhoids and he has severe diarrhea, so he goes many times to the toilet, he's straining, he's making many effort on his anus, let's say, so maybe it will be developed to bleeding. Okay.
So is it, can we say diarrhea or loose motions also lead to hemorrhoids?
Both of them. Constipation is the main reason, but diarrhea can not cause hemorrhoids, but can maybe, let's say, make more effective or more active.
Okay, it can aggravate it if
yes,
it's
activate it.
It's active. And what kind of hemorrhoids do you see? Internal are more common or external? As per your experience that you've had, or is it?
Actually, we have both, but nowadays more frequent is the internal, because this is the real hemorrhoids is the internal.
Okay.
We can see now more because we can check the patient earlier than past time.
Okay. So
the previous time they are just staying until they have something very severe in their anus to go to the doctor.
Okay.
Nowadays, no, we can check before that.
So when the hemorrhoids are external, people can feel it. When it's internal, can people feel that? They don't.
If it's not prolapse outside
Then
and stay outside like degree 4th or 3, they can't see
They
or they can't feel unless they feel there's some painless bleeding. That's it.
Oh, that's
Otherwise, there's no pain.
Then
that's what I mentioned. Internal hemorrhoids is not painful.
So do you recommend if somebody has this in the genes for them to come regular checkups just to check them, to see if everything's okay before it reaches stage 2, 3, or 4?
As I mentioned, when they have any difference in their defecation or habit of stool, they will check.
They will check. Otherwise, they don't need to come for regular checks.
It's not necessary because it's not something dangerous. Just if there's something changed, they will check.
Okay. So, Doctor, on that note, thank you so much for joining us for this session. It was lovely to have you. I'm sure our audience have really benefited from this talk.
Thank you very much.
Hopefully they are more open.
Everybody is hearing us and...
yeah, hopefully they are more open to coming and meeting doctors and actually discussing this for their own health's sake. Thank you. Thank you, Doctor. Thank you.